Hello, I'm James Wilson. We shot this film early in the year in very different circumstances. The coronavirus outbreak has highlighted some huge questions about the role of the state, such as how to weigh the protection of health against the value of liberty and the protection of economic activity. My specialism, public health ethics, has never been more relevant than it is now.
I guess each of us perhaps thinks that we know what health is, and that for many people they don't really think about their health until something goes wrong and then they need to go to the doctor. But as a specialist in public health ethics, I tend to think about health in a much broader sense. I'm interested in particular in not just how people feel on a day-to-day basis or the moment when they have a heart attack or a stroke, but all the often minute and subtle risk factors that can lead up to that, which can be socially controllable. Public health is really what the state does, or what we all do, in order to ensure the conditions within which we can be healthy. Back in Victorian times, one big public health intervention in London was building the sewers. That enabled a shift from open defecation into the River Thames, into thinking, well, how do we manage waste products so that they're much safer to human life and health? A lot of my thinking is centred around the idea of health as a human right. Now, that's often a surprising idea to many people. They have the idea that perhaps we have a human right not to be tortured, or even a human right to a fair trial. But they're often confused about, well, how could health be a human right, particularly as each one of us is mortal, we're all going to die at some point. People often say there can't be a human right to health because my right will be violated if I die. That's not what the human right to health means. Nobody thinks it means it's a right to be healthy, but rather human health and well-being is so important that states should have obligations to respect, protect and promote health. Many people sort of accuse what I stand for as being nanny state. Now, it's an odd sort of complaint, because when people accuse state action of being nanny state, I think what they must mean is that the state is intervening in a way that's unwarranted, it's meddling, it's interfering, it's somehow interfering with people's rights. Whereas if, like me, you think that health is a human right, and indeed there's a right to public health, then I'd want to say that when the state doesn't do what it ought to do, when it, through its negligence, allows people to come to harm and die, then that's when the state is violating people's rights, not when it's, for example, requiring people to wear a seatbelt and thus significantly reduce their chance of death. If there were three things that I wanted people to take away from my research, I think the first one would be the importance of philosophers actually getting their hands dirty, and rather than sitting in armchairs, but working with policymakers, working with practitioners, actually understanding what's going on the ground and the problems they're trying to help to resolve. A second would be to say that philosophical reasoning is important, is vital for thinking about public policy problems, but that philosophical reasoning needs to be on the basis of a proper understanding of those problems themselves, rather than very abstract and simplistic models of them. And the last thing to say is that philosophy can make a difference to public policy, because the sorts of questions that arise in public health are at the heart ethical questions, and that philosophers are some of the best people to help other citizens think through ethical questions and ethical challenges, and to think about how various sorts of trade-offs between liberty and improving health, for example, need to be made. So I think it's a field that philosophers can contribute to, and I'm pleased to have made it my life's work.
Looking back on what I said before the coronavirus outbreak, I think the main points still stand up well. It's never been more important for ethicists to understand the underlying science and to work across boundaries if they're to give sensible policy advice. One really striking result is how quickly social norms and the sense of what is politically possible have shifted. Some of the things I've been writing about for years, such as the need for states to be more interventionist to protect the health of their populations, now look like common sense. Once this is all over, we will be in a radically changed political and ethical landscape. It will be much more difficult for governments to drag their feet on other systemic threats to health, such as climate change or air pollution.